We'll go ahead and get started. Thanks to everyone who's joining. I'd like to introduce Mike Groh with Risk Strategies. We're grateful to have Mike here as a Medicare expert to guide everybody through this complicated topic. Mike will do some Q&A at the end. You can use the question button to submit a question. However, we realize this is a personal subject, and so if there are questions that you'd like to ask offline, or if you'd like to schedule a one-on-one meeting with Mike, we can also arrange that. You could just reach out to Evan or I. All right, Mike, I'll let you take over.
Awesome. Thank you, Darcy, and thanks for having me. Hello, everyone. We're going to go through some basics of Medicare today, how it compares to group plans if you're still working. How do you decide what do I do when I turn 65 or when I'm post 65 and I'm going to be retiring coming off the group plan. This will show you things as the owner, as the employee, as a retiree, etc. To keep a couple things in mind, that insurance by its nature is legalized gambling. So what we're looking at is different ways to assess what risk you do or do not want to take when it comes to your health insurance. Okay. And the second thing is there's a lot of myths out there of what you should do when and why you should do it. And a lot of assumptions about what works best. Everybody's situation is different. We're going to go through all the things that could impact what you decide to do and when. Okay, so it works for you, may not work for your twin brother type of thing. Okay, so kind of keep those couple things in mind as we go through this. A lot of this information will not apply directly to you, but we're kind of painting with a broad stroke, so we can cover a lot of ground. And then, as Darcy said, we got a question and answer at the end, and also I'm available for one-on-one conversations to get more deeper personal in your situation. Okay. This is a disclaimer I have to read. Risk Strategies and our affiliates, basically, we do not offer every plan that Medicare offers. I am appointed in all 50 states. We sell in all 50 states, but we don't sell every plan in every state. So if you'd like to see other options, you can go to medicare.gov or 1-800-Medicare to get that information. We're not going to talk plan-specific items, but give you some general examples and how the plans and concept worked. Okay. So we're going to talk about Medicare 101. What is Medicare? What are the four parts? What are your supplement options to compare with your group plan if you're going to keep working, if you're coming off the group? How we work with Darcy, how we can work with you if you own the company, or your HR if you'd like to get us involved with your company, and then some Q&A. Okay. So what is Medicare? Medicare is a federal health insurance program administered by the Centers for Medicare and Medicaid Services, or CMS. It's designed for people who are 65 and older, who are at any age and are disabled, and are at any age and are diagnosed with end-stage renal disease, which is kidney failure. Okay. Excuse me. A little bit of seasonal allergy. Sorry. So there's four parts to Medicare: A, B, C, and D. A and B you get from Medicare. C and D is regulated by Medicare, but you get it from a group health coverage or Medicare supplement, Medicaid, or Medicare Advantage plan, or standalone prescription plan. So what we're going to compare is we're going to assume that everybody here is turning 65 next month and they're going to keep working. So what are my options if I stay? Why would I stay on my group plan? Why would I go to one of these other two options? And how do I make that evaluation? Okay. So you're going to have three choices: stay in the group, get A, B, a supplement, and a prescription plan. So you're buying three policies, or A, B, and a Medicare Advantage plan, where you're just buying one policy and the Advantage plan combines the medical and the prescription into one plan. Okay. So when you apply for Medicare, if you are getting your Social Security check prior to age 65, okay, then Medicare assumes that you want your A and B to start on your 65th birth month. Okay. Now, if you're getting your Social Security check, you can delay Part B because there's premiums to that, and we'll go through some reasons why you might do that. But you cannot stop Part A if you're getting your Social Security check. And that could have some implications if you stay on a group plan, particularly if it's a health savings account plan that you're on. Okay. If you're not getting your Social Security check, then everybody has what they call their initial enrollment period, which is a 7-month window. This is the 3 months before the month you turn 65, the month you turn 65, and 3 months after. Okay. One big myth is that you have to do something when you turn 65 or you're going to get a penalty. Medicare does that to kind of scare you a little bit to make sure you look at what you're supposed to do or should do. There's three things you can do. One is to do nothing. Do not get A, do not get Part B. Two, get Part A, delay Part B. Or three, get A and B. So we're going to walk through the different reasons why you might do any of those three things. Okay. If you or your spouse, excuse me, if you're covered under you or your spouse's current employer group plan, then that's when you may do any of those items. You could delay A, you could delay B, and you won't have a penalty, provided your group plan is credible. Medicare is only going to penalize you if you go periods of time without credible coverage. Okay, so by and large, the majority of group health plans are credible. So you don't have to choose something or come off the group plan in many situations. Okay, so a lot on this page, basically, you got certain timelines to make decisions, and one of those decisions can be to do nothing. Okay. So what is A and B? Well, Medicare is never intended to pay 100% of healthcare costs. It covers the lion's share, and we'll go through those details, but it wasn't meant to be the end all. It's meant to have something help it and put caps on some of the expenses. Medicare does not cover non-medically necessary items, similar to your group plan. If this is the year for that tummy tuck or that Botox injection, you're probably paying for that, okay? And it does have some limitations on care outside the United States. Part A is your hospitalization. This is if you're admitted to a hospital, or if you're admitted to a skilled nursing facility after being in a hospital, or admitted to a home healthcare situation, or need home healthcare care after being in the hospital, or hospice. So basically, you're being admitted somewhere, spending a night, however you want to put it. Okay? The Part B is everything else. This is all your doctor visits, x-rays, blood work, outpatient surgeries, chemotherapy, durable medical equipment, everything other than staying somewhere. So a big bucket of things fall under Part B, okay? Your preventive items are going to be similar to your group plan, where if it's something you're supposed to be doing based on your age, gender, and timing, once a year, every 2 years, every 3 years, every 5 years, it's generally going to be covered in full by Medicare. Okay. Some other examples, if you're getting a vaccine, like for the flu, pneumonia, hepatitis B, diabetic testing supplies. This is covered under Part B. So this is the test strips, the lancets, some stuff like that, stuff to test your diabetes level, your sugar levels, not the actual medicines or the apparatuses. Okay. Medicare has a welcome to Medicare annual wellness check program. This is the first 12 months that you're on Medicare, where they're going to waive the waiting periods and timing issues for all the preventive items. Kind of like when you see a new doctor for the first time and they order that wave of tests to kind of see who you are, to give them a baseline on who you are. That's what this 12-month period does, and allows you to get those tests, even if you just had something last year, the year before. You can start anew. Okay. There's a complete list of this at Medicare.gov, or there's an annual publication called Medicare New Handbook that will give all the details. But in general, it's going to be the same as your group health plan. For 2025, there's certain figures. These numbers can change from year to year. We don't have all of them for 2026 yet, but the numbers aren't as important so much as the concept. Okay, so Part A, your premium for most folks is going to be $0. If you or a spouse worked 10 years and contributed to the Medicare program, you're going to get it for zero premium. Okay. If you didn't, or your spouse didn't, or whatever mixture, and you don't qualify, there is a premium, and it can range to $300, $400, $500 a month if you fall in that position. I'm going to assume everybody here qualifies for the premium-free Part A. This year, there's a hospital deductible of $1,600 and change. This is per benefit period. So if you fall today, break your right leg, and on the way up to the hospital tomorrow, you fall, break your left leg, that's a separate admittance. But there's a 60-day period where if you're admitted for the same diagnosis, then you're not charged that second deductible. Okay? Then there's some per day charges. You can see there if you're in the hospital or skilled nursing for an extended period of time. Okay. Your Part B, there's a base premium this year of $185 a month. Okay. This premium is income-based. What that means is, and I'll show you the chart on the next slide, if you make above certain figures, they're going to charge you more than the $185 per month. Okay. We'll go through that in length there. If for some reason you do not get Part B when you're supposed to, and you do not have credible coverage, they're going to charge you a 10% penalty for each year that you went without coverage. So if you go 3 years without coverage, they're going to charge you 30% of your Part B premium, and that's a lifetime penalty. Okay, it does not go away. So that's why you hear a lot of that, like I talked about on the previous pages, about making sure you do something when you turn 65, is they don't want you getting that penalty, because once it starts, you can't undo it. Claims wise, under Part B, remember this is all the medical items. You have a $257 annual deductible. So your first 257, whether it's a doctor visit, x-ray, blood work, it does not matter. Like your car insurance, it doesn't matter what you're paying up or what it is up to the deductible. You're covering that amount. Okay? Once you get to 257 and you pay 20%, Medicare pays 80%, but there's no cap to that 20%. So if you're getting something costly, like say chemotherapy that's costly and ongoing, that 20% can add up pretty quickly. So this page shows A and B's coverages. It's the same for everybody. The only thing that changes is based on your income. If you're very low income and qualify for Medicaid, they'll fill in many of these costs for you because you can't, they're doing a needs-based analysis. If you're over the income we're going to talk about on the next page, you're going to pay them more than $185 per month. But other than that, everything is the same. Okay. Now, as far as your Part B premium, if you're getting your Social Security check, that will come out of your Social Security check when you enroll in Part B. If you're not getting your Social Security check, then Medicare's default is to bill you quarterly. Okay. You can change that to a monthly bank draft if you like, but their default, as I said, is to bill you quarterly until you start taking your Social Security check. This chart is called IRMA, Income Related Monthly Adjustment Amount. What happens is when you apply in 2025, they're going to look at your 2023 tax return. Okay, because if you're applying and say for January of this year, you wouldn't have filed your 24 tax return yet. So they're going to use the one that they most likely should have, they being Medicare. Okay. You can see there's a couple of different levels here. If you're filing individual, if you're filing joint, and there's also one if you're married filed separately, but probably 95% of people or more fall in these first two categories. So if your adjusted gross falls under one of those bottom 5 or 6 categories, you're going to pay an additional premium, okay, for your Part B. There's also a charge for Part D drugs we'll talk about here shortly. But so let's say you're in that second last column, you're single and you make $400,000 a year, well, you're going to pay $591 and change for your Part B per month. Okay. Now, this is your starting point, meaning they have to start somewhere. Okay. If say you're retiring or you had a great year in 23 and 24, you made a lot less. These numbers are adjusted each year. They just follow about 12 to 18 months behind when you actually made it, because they have to have time for you to file your taxes and for it to get to Medicare and for them to work on it to make the adjustment. And they will make the adjustment back to January of that year. These numbers are important for several reasons. One, if you're turning 65, like we talked about at the beginning, and you're going to keep working, what you're looking at is my group plan better than I can get for individual coverage on Medicare. So obviously, if you make a good living, your premium is going to be higher, which might make Medicare less attractive than staying on a group plan. Okay. Also, if you're retiring or cutting your hours, you're losing group for sure. You want to be able to plan what your premiums are, obviously, so you can budget accordingly. Okay. So once again, you have to start somewhere. It can be adjusted. You can write for Medicare for an appeal. They'll listen to any story, whether they act on it or not. It depends on your situation, but they will listen to any story. So maybe you had a great year. Maybe you got some investments that you cashed in or got an inheritance, something that jacked up your tax return higher than normal. Or if you have a situation where you're retiring or you went part-time and you had some lag time before the reduced compensation caught up with you, it is flexible. Okay. So you're turning 65, you're going to keep working. So you know what your group plan is. What's your premium for your group plan? Is it $200 a month? Is it $100 a month? What's your cost? What is your deductible and your out-of-pocket maximum? Meaning, what are you going to spend to have the plan, and what could you spend if you have a bad year? Okay. You're comparing that to your individual options. So a couple of considerations you have to think about here. So if you work at a company that has less than 20 employees, and using that example, you're turning 65 next month. On September 1st, Medicare does everything the first of the month. On September 1st, your group plan is now going to be secondary to Medicare. So Medicare is what they call primary. So if you're on a small group, less than 20 employees, you have to get A and B, whether you stay on a group plan or not, because the group plan is not going to pay what A and B are supposed to pay. So if you're 65, you work at a company that's got 10 people, you turn 65 next month, your claims as of 9/1, Medicare is primary. Okay. Now, Medicare realizes this is a situation. If you have to get A and B, then why would you stay on the group plan? Because now you're looking at the group plan premium versus what you could get individually. And 99 times out of 100, that individual plan, not counting the Part B premium, because you've already got to pay that if you stay on the group plan, the individual coverage is going to be cheaper and better than the group. So Medicare realized that was a situation. Technically, groups are not supposed to pay for individual coverage for their employees. But in this situation, the employer can reimburse the employee for their Medicare premiums in a pre-tax fashion to the employer. So let's say your group plan is $1,500 a month, and we can get you Part B and a supplement and a prescription plan for, say, $700 a month, where you just saved $800 total premium. And generally, that supplement is going to be better than your group plan coverage wise. Why would you not do that? So it's a win-win for the employee and the employer. So they allow the employer to reimburse them that $700 or less or plus claims. They just have to do the same thing for anybody who's in that situation. Okay. They can reimburse the employee pre-tax to the employer through an HRA arrangement. Right? So generally, the only time people don't come off the group plan in that situation is if maybe you have a younger spouse or a dependent, that the group coverage is far better than what they can get if they went to an individual plan. Okay. So lots going on there. But so basically, if you're in a small group, we want to have a conversation to make sure that you have your A and B set up. Because if you do not have A and B set up and you have a claim, what happens is the group will pay it, then they'll go back to Medicare, and Medicare will come after the employer to get reimbursed for the claims that the group plan paid. Okay. Now, if your company has more than 20 employees, that whole scenario is reversed. So on 9/1, using that example, your group plan is primary and Medicare is secondary. So the group plan is still in charge. Okay. So then you've got two options generally to do if you're staying on a group plan. If you are on a copay plan, meaning you have doctor visit and prescription copays, you are generally going to just get Part A and delay Part B if you're staying on a group plan. You would get Part A because remember, it is zero premium for that. So it's not impacting you're not paying anything for it. And it could help if you have a hospitalization claim prior to you hitting your deductible or your max out of pocket. Okay. Because remember that Part A's got that $1,600 deductible, then it pays 100%. Now, if you're on a health savings account plan and you and or the company are contributing to that, then you cannot have Part A and you cannot have Part B and keep contributing or getting contributions. So in that situation, if you're on a large group, more than 20 employees, you would delay A and B if it was deemed that the group plan was better than going individual coverage. Okay. So now when you delay A or B, as long as you're under credible coverage, you can get A or B later without penalty. What happens is your Part B, you can sign up to 90 days in advance. Okay. So let's say 2 years down the road, you're going to retire for January of 27. Well, as of October of 26, you can sign up for Part B to start for January. Okay. You can sign up to 90 days in advance. Medicare always does everything the first of the month. But since you delayed your Part A, when you go to apply for your A and B, your Part A is going to backdate 6 months from the month that you applied. So to go back to October of that year using that example. The reason they do that is to protect you if for some reason you lost your group health coverage unaware and you were unaware of that you at least have medical hospitalization coverage going back 6 months, and it doesn't impact you premium wise, but that does impact the contributions because now technically your Part A started April 1st of that year, which means you could only contribute for the first 3 months or 25% of your annual total. So if you make contributions during that time frame, or if your company did, they'd need to be reversed, or that additional money is going to be treated as income, and you're taxed at 20% penalty. So if you stop your Part A and Part B because you're going to stay on a group health plan that has a health savings account feature, you want to plan ahead, if possible, to stop those contributions. Okay. And we can walk through this timing issue if this applies to you. So that's one of the main reasons why you would not get A or B when you turn 65, because you're deemed that the group health plan is a better deal than what you can get on your own, and you're going to take advantage of those health savings account contributions. So on this page, your income matters because it determines your Part B premium. Where you work matters, and what type of plan you're on matters. Okay, so lots of moving parts as to what you may or may not do depending on your situation. Medicaid's for those who have limited income. It helps fill in some of these costs. I'm going to move on from that. I don't believe anybody on this call falls in that category. So you're looking at a Medicare supplement. So you got two ways you can get coverage individual with Medicare: a supplement and a Part D, and an Advantage plan. So on a Medicare supplement, you have your Part A, you have your Part B, and you're getting a supplement through an insurance company that works with original Medicare. You may have heard this called Medigap or MedSup. So what you're doing is you're layering your coverage. Your A covers hospitalization items, B covers medical items. The supplement helps fill in what those items are missing, what A and B is missing. Okay. So with the supplement, all the plans are standardized. So you can see the plans there in parentheses, A through N. So if a carrier does not have to sell all those plans, but if they sell them anywhere in the country, the plan is identical. So we use Plan G as an example. That's one of the more commonly sold plans in today's marketplace. Plan G pays everything that Part A does not cover, and pays everything that Part B does not cover, except for the Part B deductible of $257. Okay. So let's say you're turning 65 next month, and your Plan G is going to be $200 a month. I'm just making up a number for conversation. Okay. So you got your Part B and that premium. You got your Plan G at $200 a month. So let's just say your Part B is $300. So now you're looking at $500 in monthly premium between your A, B, and G. Well, G fills in everything but that $257 deductible. So you're paying $500 a month of premium, $6,000 a year, and you only got $200 in change out-of-pocket exposure. So that's what you're comparing to your group plan. What's my premium? What's my deductible? What's my out-of-pocket exposure if I hit that max out-of-pocket? Okay. Now, carriers, I said all the plans are the same. So if they sell Plan G, it's identical. The only thing that changes between carriers is the premiums could vary, and they may offer different freebies to go with it, like gym memberships and things of that nature. But if you buy Plan G or Plan N, whatever, it's exactly the same wherever you buy it. Okay. Now, when you get a supplement, you're basically prepaying to limit your costs, like we just explained there about Plan G. You also do not have a network because Medicare is primary. So you can go to any provider who accepts Medicare in the United States. Okay. If they take Medicare, you're good to go. Doesn't matter if they take Blue Cross or Humana, United, whoever your plan is. Okay. It's do they take Medicare? With Medicare in charge, they're determined if it's a claim or not. If they say yes, it's a claim, then they and your supplement both pay. If they say no, this isn't something we cover, then neither one pays. Okay. So generally with supplement, you're paying for peace of mind, ease of use, because you don't have a network. You're limiting your exposure. You're paying up front to not have to worry. Where can I go? What's it going to cost me? Okay. And when you sign up for a supplement, whether it's when you turn 65 or shortly after you get your Part B and come off the group plan, it's a guaranteed issue situation. What that means is there's no medical questions. There's no waiting periods. There's no pre-existing waivers, things of that nature. So as long as you do everything in a timely fashion, you can get what you want regardless of your health. Okay? And in special situations is if you lose group coverage, if you decide after your 65th birth month, after that 7-month initial period, that you generally have a 63-day window to take care of your business and get a supplement guaranteed issue. Okay. After you make that choice, the first choice on a supplement, you want to change it later, there can be some implications. We'll talk about that shortly. Okay. If anybody on the call fits this category, of being 65 or eligible for Medicare before January of 2020, then you can get Plan C or Plan F. Plan C and F pay everything that A and B does not cover. So it's one step better than that Plan G. It does cover the Part B deductible. Medicare grandfathered these out because they felt they're too rich of plans. People weren't being judicious in their healthcare usage. So that's when G became available, and they created a high deductible Plan G also. All of the plans remain the same. Not every state can you get G or F if you fall into that category, but if you do, we'll walk through that with you so you can see the differences. Generally, C and F are priced where it doesn't make sense to get them, where Plan G, it's a better option because you save more than that $257 a year in premium. Okay. So you got looking at your Part A and B, looking at your group health plan or Med Sup. Now you got to talk about your prescription coverage, the Part D. This is that same chart that we showed earlier. It's just that the dollar amounts on the far right, the surcharge is significantly less. Okay, so you can see there is a surcharge for your Part D. You get this surcharge if you take an individual Part D plan or you take a Medicare Advantage plan that we'll talk about shortly. Regardless of the plan you choose, you still pay this surcharge to Medicare. So the range is from $185 to $715 a month. So if you're in the highest bracket, you'll be at $715 a month for the B, the surcharge for B, and the surcharge for D. Okay. If you choose a Part D plan, either with a supplement or with a Medicare Advantage plan. If you stay on a group plan, then obviously these are not at play. And this follows the same situation we talked about earlier. It changes from year to year. It starts with the 23 tax return if you apply this year, et cetera. It's just a separate charge that follows the same chart. So prescription plans you can get as a standalone plan or with a Medicare Advantage plan. So for right now, we're going to talk about the standalone plans that you get to pair with your supplement. Okay. So you're buying two policies going this route, one for the medical, the supplement, and one for the prescription Part D. They do not have to be the same company. They can be different carriers. If you and your spouse are both applying, you're two individuals. The only connection on the supplements is you may get a spousal discount if you both use the same carrier. But other than that, you're getting two different, you're two individuals. So with the Part D, you have the same initial enrollment period as the Part B. Okay. I mean, that 7-month window when you first turn 65. Okay. You only need Part A to get Part D. So there are situations where someone might just get A and D. Could be if you've got the VA or if you've got a high deductible HSA plan and you want to get the Part D to have better prescription coverage and you're not worried about the HSA contributions. Okay. But generally, those are rare situations, but they do pop up. Every year, there's an open enrollment period from October 15th to December 7th. Okay. This is generally for folks who are already on an individual plan and are looking to make changes. Okay. But if for some reason you did not have coverage for your Part D, this is when you can enroll also. And when you enroll, the coverage begins January 1st. So Part D plans, you're just renting them. So if you choose that supplement Plan G and you choose a prescription plan, the supplement you're generally looking at as a purchase. Okay. The rates vary by age, gender, and where you live. But once you get in it, they're not going to take it away from you. You don't have to renew it each year. It's an automatic renewal. The prescription plans, though, you're just renting those for that calendar year. So using that example that you turn 65 next month, we could start you with a Part D for 9/1 to get you to the end of the year. Then on October 15th to December 7th, we can evaluate what's the best plan for you for next year. Okay. And there's never any medical questions when you move from one Part D plan to another. It's always a guaranteed issue situation. You just have to do it in the right time. Okay. And what we do, there's a program at Medicare.gov, and there's a few other special programs that we can get where basically you can punch in or we can punch in your prescription usage, your favorite pharmacy, et cetera, and we can predict out over 12 months what's going to be the best plan for you with or without a deductible, show your copays or your percentages that you will pay, and project your cost and give you a template to run on for the next 12 months. So we run that with you each year if you sign up with us, so you can see those items and determine which prescription plan should I stay with or should I switch, et cetera. For this year, the average premium is 31 and change. They range from zero to about $120 or so a month. Some plans have a deductible. It can be up to as high as $590. Now, this is for higher cost drugs. Most plans have 5 or 6 tier levels for their formulary, with this tier 1 being basically the zero or maybe $1 copay generics or brand name drugs. And then tier 5 or 6 would be your more expensive injectables and specialty type drugs. So the deductible only applies for brand name drugs and above. And that's not per drug, that's a cumulative. So if you're taking, say, 2 $400 eye drops, you don't have to meet the $590 with each one of them. It's just $590 between them. And then your copay or percentage kicks in. Now, for this year, Medicare did away with the dreaded donut hole or coverage gap scenario, which you may have heard about. So what happens is you're having a copay or percentage, and they're keeping track of what you pay. And if you get to $2,000 in covered drugs, then you're done for the year, and those are covered 100% by the carrier. Okay. So using that example, you're taking 2 $400 eye drops. Obviously, you could get to $2,000 pretty quickly, depending on what the copay or percentage was. So you're capped at $2,000. So going back to the example that we used, that your Part B was $300 and your supplement plan G was $200, and let's just use $31 for your prescription plan. So at $531 a month, a little over $6,000 a year, your exposure is $257 medically and $2,000 prescription. Okay, so you're about $8,200 in total exposure, premium plus medical claims plus prescription claims. So that's what you're comparing to your group plan if you're still going to keep working. What does my group plan cost? So if my group plan costs $250 a month, that's $3,000 annually. If you got a $5,000 deductible, okay, so now you're at $8,000 out of pocket. So it's a close match to the example I just gave you. That's what you're comparing, and we can help you look back and forth to see which way might be a better situation for you. Okay, so things to consider with prescription plans is each carrier has their own formulary, they each have their own copays and their own tier levels that they decide. If for some reason you do not have Part D coverage for a period of time, there's also a penalty there. It equates to, it's 1% for each month of delay of the national average premium. So it comes to about $5 a month or $60 a year for each year that you went without coverage. So nothing that's going to change your life, but something you want to avoid if possible. And generally, as long as you're on a good group plan, you're not going to have that concern. Okay. So once again, in prescription plans, you can change each and every year because you're just renting them. This just kind of reviews what I just said. We can review these each year to make sure that you're in the best situation. So you know what your group plan is. We just talked about the supplement and the Part D. So your second option as an individual is what they call Medicare Advantage plans. So you have to have A and you have to have B. And these are county-based, meaning the plans can change based on the county that you reside in. So if you live in one county and your twin sister lives in the next county over, you may have 2 different types of plans you can choose from, okay? Or from different carriers. It can vary by county. There's no age or medical restrictions. What that means is if you and your neighbor, you're 65 and he's 95 and you got by the same plan, it's the same premium. It's the same plan. There's no age variance, okay? There's no medical restrictions. You can always get a Medicare Advantage plan. You just have to sign up during the right time frame. There's never medical questions, never pre-existing, no waivers for pre-existing, okay? Whereas the supplement, as I talked about, remember, that is based on your state, your age, and your gender, what your rates may be. Okay, so a big difference there. So the Medicare Advantage plans are more standardized, more level, without individual differentiations. Okay, so what happens with an Advantage plan, you have to have your A and B, but if you sign up, you're generally going to get a medical and prescription plan combined. There are some plans that do not have prescription coverage. Those are designed for people who maybe have VA or TRICARE type coverage, okay, who don't need prescription coverage. But for this conversation, we're going to assume everybody needs the Part D. So you're buying one policy. So the medical under Part C and the prescription under Part D is in one policy. And what happens with an Advantage plan, is Medicare is going to pay your carrier a check for about $800 a month or about 10 grand a year. In exchange for the carrier cashing that check, they agree to pay your claims for Medicare. So all your claims, medical and prescription, go to the carrier, and they pay A and B's responsibility, and they pay their responsibility under Part C, the medical, and Part D, the prescription. So the carrier, think of it in a business sense, they found a way to get paid 10 grand a year for everybody who signs up. So their challenge is to make the plans nice enough that you sign up, nice enough that you keep them, but they put some variables in there to kind of control the cost a little bit. So there's a give and take. The first give is that a majority of the plans are zero premium or close to zero premium. So you're not paying that $200 for your plan G and that $30 for your prescription plan. So you just save $2,000 or $3,000 in premium per year. Okay. First takeaway is all the plans are network based, meaning you can get an HMO network. That means they're telling you where you can and cannot go. They're giving you a list of doctors, hospitals, labs, etc. You have to stay with the program. Like a coupon, you have to go where the coupons accepted. With an HMO, if you go out of network, it's not an emergency, you have zero coverage because A and B follows the network, okay? Because it's all being paid by the carrier. If you go out of network and it's emergency, it's considered in network as long as emergency is at play, because they don't want you driving past one place to get to another place when you're in harm's way. You can also do a PPO, which allows you to go in or out of network. Just if you go out of network and it's not an emergency, you still have coverage. You still have a cap on your expenses, but you're going to pay generally quite a bit more than if you stayed in network. So if you think of a network as a coupon, you want to go where the network, where the coupon's taken. Okay. And these networks by design are generally smaller than what you're used to on a group health plan. Okay. You still have your A and B. You're still paying your premium for A and B. Medicare is paying the carrier, and you have networks. We talked about that. The premiums can vary. How they pay claims is it's a pay-as-you-go process. So let's say you choose a plan with ABC Company, and you choose a PPO plan. It's got zero premium, and say it's got $5,000 out of pocket. What that means is the out of pocket is you're going to pay a copay or percentage for every line item claim that you have. So every X-ray, blood work, trip to urgent care, every single thing you can get billed for other than preventive care and hospice, those would be free. But everything else, you're paying 20% or less of the bill. So if you're admitted to the hospital, depending on the plan, you may pay $300 to $400 a day for 4 or 5 or 6 days, and then you're capped. You have the doctor visit, probably $0, $5, or $10 copay at a primary care, 30, 40, 50 at a specialist. If you need an MRI, it's probably a $285 copay. Durable medical equipment, chemotherapy, you're paying 20%. So it's either a percentage or a dollar amount of each bill. Okay. But Medicare and the plan are going to be paying 80%. So you're piecemealing that claim. Then if you got the $5 grand using that example, you had enough claims where you got the $5 grand, then the carrier will pay everything at 100% for that, going forward. So you're getting more help up front than maybe your group plan, but it's piecemeal and you have a network to contend with. Okay. So the plans can range from anywhere from about $3 grand to about 9 or 10 grand out of pocket. So there's a big variance depending on where you live and what plan that you like. Okay. So with an Advantage plan, the carrier's in charge. They're setting the networks. They have folks who are looking over your shoulder to make sure that you're doing your claims properly. Okay. So there's more oversight. You pay as you go, but for claims, so you're betting on your good health generally if you go with an Advantage plan. Okay. I don't need to pay for that plan G. I don't go to the doctor, however you want to rationalize it. Or maybe you've got the money set aside that you just don't want to pay the premium. You're saving money on premium, but you're betting on your health. Compare that to the supplement and Part D. Compare that with your group plan. So 3 different ways to gamble on covering your health. Advantage plans have the same initial enrollment period when you turn 65. Okay. They have the same open enrollment period each year, October 15th to December 7th. So you can make changes to your plan. And so if you start off with one company, you want to switch to another company or go from an HMO to a PPO, within the same company or from company to company. You can do it every year, never any medical questions. And there's also special enrollment periods, like if you move or the plan dropped or you're institutionalized in a facility, things like that, where you can make changes. But generally, you're going to do it at the end of the year. Then Advantage plans have their own open enrollment, January 1st to March 31st each year. If you're on an Advantage plan, you can switch plans during that 3 months, or you could drop the plan and go back to original Medicare A and B and get a Part D plan. Okay. The reason they have this extra open enrollment period is, let's say you signed up with a company because they had the local hospital system. And on January 2nd, they say, hey, the hospital system is now out of network. We don't get along anymore. Well, what do? That's why you sign up for that plan. So there's things that can happen outside your control, more so than a supplement. So they give you an extra time frame to make some changes. Okay. You may have heard people say, I'm on my plan and I'm stuck, or I can't change plans. Generally, that means you're on an Advantage plan and you're not healthy and you can't get to a supplement. So there's some different rules of engagement here. When you make your first choice, remember I said you get guaranteed issue for supplements. But after you make that first choice, if you want to make some changes, there can be some restrictions. So if you start with a supplement, it's guaranteed issue to drop to an Advantage plan, because a supplement is the upgrade plan. The Advantage plan is the base plan in layman's terms. So if you're going from a supplement to the upgrade, you can always drop down to the Advantage plan. You just have to do it during the open enrollment period. Okay, you're taking more risk. The carrier has less risk, so they're going to make it easier for you to do that. If you start with one supplement and want to go to another supplement, okay, generally that is not a guaranteed issue situation, meaning the carrier has the right to ask you medical questions and can turn you down. Now, some states have some provisions where you can do that without health questions. Some allow you to do that around your birthday. You have a special time of the year where you can do that. But in general, you can switch supplements at any time. It just is a guaranteed issue or not. Okay, so there's no open enrollment period to go from one supplement to another. So you can do it in May, June, July, does not matter. It just, can you do it with or without medical questions? If you start with an Advantage plan, as I said earlier, you can switch to any other Advantage plan during your enrollment period. So there's never medical questions. If you start with an Advantage plan and want to go to a supplement, many times if you're on it the first time when you turn 65, if you're on an Advantage plan, within that first 12 months, you can opt out and bump up to a supplement. But after that, it's generally guaranteed. It's not a guaranteed issue situation. I mean, you have to pass the supplement carrier's questions and pass their underwriting in order to be granted. So if you hear somebody say, I'm stuck on my plan, it generally means they have an Advantage plan and they've got situations where they can't move up because of health conditions. Okay. So when you're starting out, if you're in good health, that Advantage plan may limit you later if you want to change or get to a better plan. So sometimes you're not always buying for today, you're buying for tomorrow. Okay. So we'll go through this with you if we talk with you about your situation, so you can understand what can I do and when, and how hard is it to change, etc. Okay. A little housekeeping. Medicare makes us say these items. Medicare's a little different. I can't just pick up the phone and call you. I can't run a list and cold call you. If I talk to you and your brother or your neighbor says, hey, send this guy my way, I generally can't call them. Normally, you have to reach out to me, unless there's a business situation. If you're a client of one of our strategies, we have a business reason to talk, etc. Okay. But we can't do door-to-door sales. We can't give out cash or cash equivalent. We can't do high pressure sales. Can't misrepresent a plan. We can't represent ourselves as being from Medicare or endorsed by Medicare. Okay. Things of that nature, common sense type thing. The biggest thing here is we're not supposed to call you. For anybody who's turning 65 or been 65, that doesn't always happen. So if for some reason you get caught up in that, you want to do something about it, you can report all that to the Department of Insurance. Okay. And hopefully they can put an end to whoever's doing this. So how I work with the folks at NELS at the Capitol, Evan or Darcy, whoever, or with you, is we try to have a relationship where we're on your team. Okay. We're here to help. We're here to advise. We're not just here to sell. We'll help you in any way we can, help you compare options, compare the deductibles, out of pockets, everything we just talked about. Okay. If you run a company, we'd like to talk to your folks if possible. Put on a webinar like this. We're just looking to find win-win relationships where we can help you, you can help your clients, you can help your employees, etc. Okay. And we'll talk all day long, advise all day long. In my business uh, plan, or however you want to say it, I know if I talk to enough people, eventually enough people are going to purchase something. Okay. So we'll help you however you need it. There's no question too small or beyond pale.
Thank you, Mike. And maybe if it's okay, we can use the time to
Mhm.
kind of go through two questions that were submitted in the
Yep,
attendee.
yep.
The first question is, we offer two plans, Kaiser and Aetna. Is the 20 employees per employer or per group plan? So for example, Kaiser might have 40 employees enrolled, Aetna might have 18 employees enrolled. If I'm on the Aetna plan with 18 employees, can that still be my primary insurance?
No, so it's not who's enrolled, it's how many people work there. So it's employee count. So in that situation, you're talking 50 or 60 or more people. So that would be a large group. So it doesn't matter who's on the plan, it's how many full-time employees are there.
Okay. Second question, my company converts my sick bank to an HSA. This will happen on my 65th birthday. Do I get taxed on this? And is there the 20% penalty?
Only if the contributions are made after you're 65 and you have Part A or Part B. So you have to have A or B in order for there to be a penalty. Okay. Just turning 65 does not trigger that. You have to have A or B in place. Now, let's say you turn 65 in July and you get Part A or B and they pay that to you. Well, then technically you can only get 6 months worth or half the year because you're only eligible from January through June. So your birth month doesn't necessarily dictate anything. It's when does your A and B start?
So
A or B, I'm sorry.
if this person retires on their 65th birthday,
So they can get contributions up to 6 months worth or half their annual total. So if their annual max that they're allowed to put in, let's just say it's $5,000, they can only put 2,500 in. So it just depends on how many months you are eligible. If their birthday is in April, so that Part A starts April 1st, that means they can only put in 3 months, January, February, March, or 25% of the total. So you can't lump sum it in January, put a whole year in if you get Part A during the year. So that excess amount over that allowable amount is what's treated as income and penalized. So
okay.
if the company's paying you, sometimes you can't control when they do it or how much they give you. So
But what
if you're
about
using
specifically the lump sum from the sick time?
so let's say they put in $5,000, in January and their birthday is July. So they're eligible for 6 months worth or half the total. So using that dollar amount, so that means $2,500 they were allowed to contribute. So the second $2,500 would be subject to income. So it's not a write-off off your income, and that would be subject to the 20%. So if it's coming from the company, you're just getting less than $5,000. If it's coming out of your pocket, then it's actually costing you money. So it's less of a gift if they're giving you the money, so to speak. Does that make sense?
I think so. We can go offline with more specifics if you'd like. I think that's it for questions, but I want to say thank you again, Mike. This was very informative. This webinar will be recorded so we can share this for anybody to review this and look in more depth. And again, feel free to connect with any of the advisors, Evan, myself, Steve Philpott, Brooks Nelson. We're happy to set up a one-on-one meeting with Mike to go through your specific case and examples and answer any specific questions that way. So thanks to everybody, and thanks, Mike, for being here.
Thanks for that, Tony. Have a great day.
All right, take care.